All right, everybody, welcome to another of our weekly Zoom calls. This is a great reminder verse not to be anxious about anything, but take everything to the Lord in prayer. Interesting how Paul writes it, with thanksgiving. Present your request to God. Sometimes with me, it seems to be with whining or complaining, and I need to be checked on that. So we take things to God in prayer with thanksgiving, with a grateful heart, thankful that we're alive. Remember that, yes, we want, to be healed, or we want this or that, or whatever from Him. And God knows it before we even ask it. But it's a good reminder we're called to have that relationship with Him, to be asking Him things. But doing it with a grateful heart, a thankful heart, praising Him that He is our sustainer. And we are only alive today in this sliver of time that we call our life right now, that we need to stay focused, no matter how rough our circumstances are, on eternal perspectives. But in comparison to eternity on a timeline, it is literally a pinpoint in time of this life that we have of 50, 60, 70, 80, 90 years compared to eternity. We need to be living for eternity. And that's how we can understand and feel and experience the peace of God, which truly transcends all understanding. And that will guard our hearts and minds in Christ Jesus. So good reminder there. Another reminder, make sure you check our blogs for different things if you're looking for different things between Zoom calls, and our members site. And I always look at our member site for any updates. We didn't have any updates this week. One update that I didn't really talk about too much last week is our courses. We have a Stop Fighting Cancer course, which nobody here needs to be on because you have all that information, or most of that information, in your member site. We have a detoxification course we're launching. We have a Lyme course, so might be interesting for those that maybe have Lyme also, or have family members with Lyme. That course could be interesting to people. And then we also will have the Rife course launched, hopefully by the end of this week, maybe by the beginning of next week, that will go live. And please do not buy any of the courses. Dustin once he gets the Rife course done, he's going to figure out to allow all our patients, all you listening to this, will have free access to those courses. So I've Stop Fighting Cancer course. There may be some new information in there that I don't think so, but the detoxification course, definitely good information in there for all our cancer patients. The Lyme course, only really for people that would have Lyme or family members that have Lyme. And the Rife course. So the Rife course is going to have even more information than what's on our Rife page here. Not necessarily information that you need to use, but more information on Rife in general and frequencies. But remember, if you haven't looked already on the Rife page of the member site, I added a bunch of new videos that were taken as snips of Q&As off the Zoom calls. So, all right, here's the first question. I just had a cholesterol test taken, a blood test, and my numbers moved up. My total cholesterol has always been high, 214 to 280. It jumped from 214 to 231. HDL stayed steady. LDL jumped up. Triglycerides, always fine, currently 88. I'm currently on a low dose of statin. I do not want to increase it. Do you have some ideas for me? Well, I can't tell anybody to take or not to take a statin, but honestly, I'm totally not a fan of statins. I'm totally not a fan of what is considered normal and therefore high cholesterol either. When I was in school, high cholesterol was considered over 250. Then they dropped it down to 220. Then they dropped it to 200. Now they dropped it to 180. Why? So that they could sell more statins. Boy, that's cynical. But honestly, it's true. So What is a normal cholesterol? Well, the truth is all your normal blood levels are normal for the general population, not necessarily normal for you. What you're truly concerned with cancer is low cholesterol. So what's common with cancer and with progression of cancer is when your cholesterol plummets to like 120. That's a dangerous sign. Having high cholesterol is not good, but you want to look at why you have high cholesterol. You certainly don't have high cholesterol because you have a deficiency in statins. Almost always a person has increase in cholesterol when it is clinically relevantly increased. It's because of some congestion in the liver. Therefore, your body makes more cholesterol. That's why people struggle with it. Clean up my diet, I'm eating perfectly, and my cholesterol didn't really budge. It's because really only about 3% of your cholesterol, blood cholesterol, has had any relationship to your diet, except that a bad diet can cause congestion in the liver. So if you eat a lot of chemicals, processed foods, etc. Problem is that once we end up with fatty liver disease, even when we clean up our diet and do a lot of really good things like detoxification, it doesn't necessarily clean up the fatty liver disease. That still exists, and that is a major issue with cholesterol. Personally, I don't worry about cholesterol until it's over 300, 320, and then you start doing some things. But there's certainly multiple nutritional things that you can do for high cholesterol. Off the top of my head, berberine, it can be good for high cholesterol. What's the other product that we had from Orthomolecular that was good for cholesterol? I'll have to think of it, and I'll remember it as we go through this this talk today. Okay. So I'm going to get back to my screen, try to do two things at once, and move that over to my screen. Secondly, my hemoglobin A1C was at 5.6. Any higher and be considered pre-diabetic. This was alarming to me as I've never been overweight nor had a thought of diabetes. I did a little homework and found that high levels of vitamin C and E and zinc plus high cholesterol can elevate hemoglobin A1C, wondering if I should adjust my supplements. No, I wouldn't. You're taking vitamin C, E, and zinc to stimulate an immune response. So that, you don't want to decrease that to get your hemoglobin A1C down. I would want to look at other things that we have going on with your diet first before I would do that. So I don't know who asked this question, so maybe set up a time to talk about that specifically. Next question. Can you elaborate on the directions for the radiation homeopathic drops and the weekly foot baths for radiation? I finished the 101 minimum full brain 10 1-minute full brain radiation treatments last week. I did one of each foot bath. The first heavy metal one turned out a ton of rusty looking stuff and made my feet achy. The second one was clear and my feet felt normal. So there isn't a way to measure the degree of toxicity from radiation in one's body. You can't measure it. So you have to make some assumptions. So when you have radiation as far as a treatment, like radiation for a tumor or radiation for a cancer in the brain, you're getting a huge dose of radiation, one that's lethal to the cancer cells and damaging to healthy cells. Now, it may be the appropriate thing to do, but you're getting a lot of radiation. You're really just doing that literally only if you only had one session of it. You should probably be on a regular radiation detox for a long, long time. I'm talking years. You do 10 sessions or 30 sessions of radiation. You should just think of that you're always going to be supporting your body to help you detox radiation. And so using the radiation homeopath as it is listed on the label, I would just stick to that. It doesn't mean you take more of it. It just means you're going to take it longer. And continuing to do detox foot baths on a fairly regular basis. Once you do radiation, maybe you're doing them every day. Maybe you're doing them at least 3 times a week. You're trying to do it on a regular basis to help your body detox. Remember, there is no such thing as I'm completely detoxed. You're never completely detoxed because you're always toxifying yourself. Maybe you're not getting further radiation, but a lot of people take the radiation drops because they had x-rays. Goodness sakes, the difference in rad dose from an x-ray or a CT scan compared to radiation therapy is astronomical. So you're getting radiation therapy, you're really getting a huge dose of rad, and you want to think about your continuing to detox on a regular basis. Back to this question, I knew I would think of it. The product that you use for cholesterol is bergamot. Bergamot. So bergamot has been shown, Bergamot. We have a product called Bergavin that can be extremely beneficial for reducing cholesterol. That's a Designs for Health product. Think about using something like that, completely non-toxic like a statin is, and can help with cleaning out your liver. Also, other things that you do to clean out your liver, like your castor oil packs and your coffee enemas. That's, again, the reason why you do it is to help your body with detoxification, help your liver get cleaned out. But remember, if you have fatty liver disease, which is so common, probably everybody has some degree of it, you may never get those down to what the medical profession considers normal levels. Next question. As part of my continued effort to stay in remission from ovarian cancer, I've decided to have my mercury fillings removed. Good idea. Unfortunately, I have several of them. Yeah, most people do. I saw a biological dentist today in Shoreview. They were happy to hear I was working with Cutter's Clinic and asked me to ask you if there's anything they need to know about my treatment before start removing, then replacing the silver fillings. So when you have your mercury fillings removed, you want to do what this person is doing. You want to go to a biological dentist to do that, because they will use a mercury vapor vacuum. They will mask you. They will do different suction techniques, and they will use a rubber dam so that they're not spilling any. When they're drilling it out, they're gasifying the mercury, and that's the most damaging part. And if you're breathing that in, you're just poisoning yourself. So, but getting that out is super, super important. So now we don't recommend people getting their silver fillings removed when they're in the throes of cancer, because it can, then you're having to deal with detoxifying the mercury at the same time. So once you're in this point of, I feel like I'm in a relative state of remission, maybe it's time to work on these other things. That's what this person is doing. So what else should you do? So when you know you're going to go and get your mercury fillings out, a couple of things. So you want to be adding binders. So if you have not looked at the 7 phases of detoxification, information. The course is one thing. That's a good thing to look at. But remember, I don't have a way to give you access to that course. But let me pull up a blog post, because I did a blog post summary of my book, The 7 Phases of Detoxification. So let me get to that and I'll show you what that is. And I made a video on it. So here's the blog post. And just all you gotta do is go to the blog section right there. Look, just start typing in detoxification or the 7 phases of detoxification. There's multiple blog posts on that. What I want you to look at is you need to be binding stuff in the gut. So you need to make sure that phase 6 that you're eliminating properly and on a regular basis. Yes, I am. Are you doing coffee enemas? Yes, I am. Great. So that will help with phase 1 and 2, and 3, that will help with phase 6. Phase 5 of detoxification is binding stuff in the gut. So you want to make sure that you're taking a binder. So in that, I list on that blog post, I list some really good binders. And then you want to make sure that you're also starting to use a chelator. Now, if you have 7 mercury fillings that they're going to take out over the course of 6 months, then it's a little bit more difficult to recommend a chelator right away, because if you're going to take a long time in getting these out, we don't want to use a chelator to pull that is pulling stuff out of the fillings that are remaining in your mouth. But still, I would recommend what's called phase 0 assist. Phase 0 assist is I think the better of all our binders. We also have Chela Clear. That's a great binder. One of those two, both of those are chelators. Those are both good chelators to take. You only need one of those. So touch base with us so we can make some recommendations for you specifically, because I don't know who it is that's asking this question. So when you're going to get your fillings out, you want to make sure that all your phases of detoxification are open. So if you have no idea what I'm talking about, go back to the blog, look up phases of detoxification. There's multiple blog posts on it. Several of them have my video that explain the 7 phases of detoxification. You can download the 7 phases of detoxification book, at least part of the book, on our website for free. And soon I'll give everybody that are my patients access to the 7 phases of detoxification course that goes through that. But when you're detoxing heavy metals, because you're going to liberate them through pulling them out of the body with a biological dentist, you want to make sure you're binding them in the guts, you're not reabsorbing them, and that you're chelating them out of the blood, so you're getting them out of the blood so they're not just transferring to another cell. Next question. Anne mentioned that the use of fenbendazole was a cancer balancer in my situation. Can you please explain what a cancer balancer means? Thanks so much. So we can't legally say this is a cancer treatment. We can't legally say this is a cancer, killer. We can't say this is a cancer, natural chemotherapy. We can't use those terminologies. So we just came up with the terminology cancer balancer. We think that's going to be a thing. So fenbendazole technically can help your body kill cancer. But we can't say that. So we use the term cancer balancer. So when we say cancer balancer, that's what we mean. We're just keeping ourselves safe. Can you explain what nitric oxide is? My conventional doctor recommended me to take 2 capsules per day. Is this okay to take with the rest of my supplements? No. So let's talk about that. So nitric oxide is a nutrient that is typically prescribed by functional medicine doctors and naturopaths and things it stimulates a certain receptor on the smooth muscles that line the arteries. So the arteries are lined by an epithelial cell, single cell epithelial cell called endothelial cells. And under that, there's a layer of smooth muscles. Now, the smooth muscles are innervated, meaning the neurological connection to the smooth muscles is the autonomic nervous system. Remember, the autonomic nervous system separates into two components, the sympathetics and the parasympathetics. So if there's a sympathetic situation, meaning a police car pulls up behind you and turns on its sirens, you feel like your blood pressure goes up. Why? Because your sympathetics kick in. What your sympathetics do is they contract, cause those smooth muscles underneath the endothelial cells to contract. Why? Because there's a crisis situation, and when those contract, your vessels get smaller. It makes the blood go through them faster because it needs to shunt blood to the extremities so you can run away. That's what a sympathetic response does. It does other things too, but that's what it does to the blood vessels. So it causes an increased blood pressure. So if a person has an increased blood pressure and that's what they're dealing with is a hyper blood pressure. So they have a high blood pressure situation. Nitric oxide would be a help for that. So nitric oxide helps to it goes and attaches to this certain receptor on those smooth muscles called the angiotensin II receptor, and it causes that muscle to relax. That's what nitric oxide does to the smooth muscles. Causes that smooth muscle to relax. Nitric oxide also stimulates another pathway. So first of all, let me finish that discussion. So the number one reason why a person would choose nitric oxide as a supplement, the number one reason is to decrease blood pressure. Number two reason is for erectile dysfunction. It can be very helpful for that because if you can open up the blood vessels, you're going to get an increased blood flow to an area, meaning a better quality blood flow to the area, more oxygenation to the area. The problem with nitric oxide and cancer is that nitric oxide also stimulates a whole other pathway called your VEGF pathway, your vascular endothelial growth factor. Well, that's really good to stimulate VEGF if your problem is high blood pressure, because you might have actually some damage to blood vessels if you've had high blood pressure for a long period of time. Therefore, VEGF would be very beneficial. Vascular endothelial growth factor would be beneficial in that case because we want to grow more blood vessels because that's what vascular endothelial growth factor does. It helps stimulate the growth of new capillaries. So we want to stimulate the growth of new capillaries, especially around my heart. So if I have heart issues, blood pressure issues, then taking nitric oxide is one of the best things for you. It's a great product. And if a person does not have cancer, but has blood pressure issues, or let's say doesn't have cancer, but doesn't even have blood pressure, but has heart issues in the family, taking some nitric oxide can be very important. We actually look at person's genetics. And if they don't have cancer, we may recommend nitric oxide based upon their genetics because that's a whole other gene pathway. Genetic pathway is how you make nitric oxide, and it connects with vascular endothelial growth factor. The problem, though, if a person has a diagnosis of cancer, is that we do not want to stimulate vascular endothelial growth factor because that will help stimulate the growth of new capillaries into a cancer. There is a boatload of research on trying to find drugs that will stop VEGF, that will block VEGF in cancer patients. So I would not recommend a cancer patient taking nitric oxide. Why? Because it stimulates VEGF, and you don't want VEGF stimulated with cancer. So that's when you could go back to your doctor and say, yeah, I've been doing some research, and I don't think I want to take nitric oxide because it stimulates VEGF, vascular endothelial growth factor, and that's not what you're supposed to stimulate when you have cancer. And there is a boatload of research on that. You could just Google it. So I'd say no to that. Okay, was more than you know, I suppose. Next, I tried to use the ionic foot bath, the Ion Pro Wave, and the device that goes into the water wasn't lighting up when placed in the water. When I pulled it out, the blue light would come on. So, okay, this is not a problem with the Ion Pro Wave. It's a problem with the computer. So if you have a problem with your Ion Pro Wave, something similar to this, the light goes on, I put it in the water, it goes off, I take it out, it goes on again. It is a Microsoft update issue. So you don't want to run the Microsoft updates. You should not have your computer connected to the internet. Make sure that your computer is on airplane mode, so it's not trying to run Microsoft updates. But the solution to this is that you boot the computer down and you do what's called a hard boot of your computer, meaning go to the power button on your computer, hold it down for 10 seconds until the computer completely turns off. Wait about 5 minutes and come back. Now turn the button, push the button on again, allow it to do a full reboot. That should fix the problem. If you have problems with it after that, then make sure you call Mike at TrueRight. And there could be something, there always could be something wrong, but that is 99 out of 100 times, it's a Microsoft issue. So we just need to do a reboot of the computer. Okay, some questions that came in. What is in protein powder that you don't have, don't like to have in it? Okay, so what is it in protein powder that you want to have a minimum of? And that is glutamine. So glutamine is an amino acid. So a protein powder, by definition, is going to have amino acids in it. That's what a protein powder is. It has amino acids in it. So there's different concentrations of different amino acids depending on the type of protein powder. Some protein powders are made, are formulated with the idea to help heal the gut. So some protein powders are formulated with different ideas, different conditions in mind. Many of the protein powders out there are formulated with the idea to help heal the gut. Well, glutamine is an amino acid which is really good to help heal the gut. Well, why does glutamine help heal the gut? Because glutamine works better than most amino acids to help stimulate growth. So when you're talking about healing gut cells, you want, rapid growth. So then they'll turn over and you'll get a new gut cell growing and it'll be healthy and you're going to help heal the gut. Well, you don't want to use glutamine, or you're going to get glutamine in your diet because it's in all proteins. You're eating any proteins, even plant proteins will still have glutamine, but you don't want to take a product that has a whole bunch of glutamine in it because you don't want to stimulate a bunch of growth. So you don't use protein powders. If you have cancer, you don't use protein powders that have a lot of glutamine in it. Usually, it's fairly easy to see. A lot of protein powders don't show the exact concentration of each amino acid. Some say a mix, so it's a little bit harder to see. Sometimes you have to go on the company's website to see, what the concentration of the amino acids are. But you want something that's relatively lower in glutamine, or it doesn't have excess glutamine compared to the other amino acids. That's the biggest thing. So you want one that's was not formulated with healing the gut in mind. Next question. Is there a website you suggest that we should look on to find a good biological dentist in our area? No, no. There may be a website that biological dentists subscribe to, but I would bet that not all biological dentists subscribe to such website. So I would look, just Google biological dentist near me, and then you can contact them. But if they have a website, then you can look at their website and see, like if they say safe mercury filling removal, and then they go into some detail how they do that, like they're using a mercury vacuum, etc. Then you could feel pretty rest assured that you're going to somebody who knows what they're doing, and that I guess that's what I would look for. I don't think that there's a website for that. Maybe Ann knows. I don't think so. Next, my blood test showed the eosinophils, lymphocytes, monocytes, and others are lower compared to blood test in May. Is this because I stopped rapid immune boost? These have to do with my immune system? Yes, those are different immune cells. They can fluctuate up and down due to exposure of different things. Typically, if you're exposed to, allergens, your eosinophils will be higher. If you're using different things to stimulate your immune system, like rapid immune boost, then all those can be a little bit higher. As long as they're still within normal range, I wouldn't be concerned about them. I'm going to a state for 3 months where cannabis is legal. At the dispensary, I had no idea what to purchase. What would you recommend for extreme pain? I stopped morphine because it didn't stop the pain and caused nausea and constipation. The Tylenol and ibuprofen don't stop the pain either. So if you're going to use some sort of cannabis for pain, you really have to go to THC. So the CBD can help with some pain, can help with some anxiety around pain, especially if you're taking it a fairly high dose. Spoke to somebody on the phone the other day that one of their issues was pain, and they were taking like 15 milligrams of CBD. I'm sorry, that ain't gonna do anything. That ain't gonna do. That's not even high enough to help with anxiety or help with sleep or anything. You need to be taking a much higher dose than that. That's CBD. With THC, I would talk to the person at the dispensary about your condition and let them make a recommendation on the dose of THC. I've not been to a dispensary ever, so I don't know how things are labeled as far as milligram dose. I think with THC, most of it will start with like a 5 milligram dose and move up from there. The thing is, whatever you're taking, whether it be a gummy or a product that is like a paste, it will stay longer in your system if you take it with a fat. So typically, in a lot of the dispensaries, you will get THC and you can buy it in a gummy. That makes it nice and easy to take because it's in a little sugar, sweet tasty gummy, because THC kind of has an ashen taste to it. It's a little more expensive that way, but sometimes people like taking it that way better. But that's in a sugar solution. You'll get a spike of THC and then it will dissipate quite quickly. If you take it with a fat, meaning you could even take it with some peanut butter or a big tablespoon of coconut oil, it's going to dissipate much more slowly, and it will stay in your system longer. I'm more in favor of using the dropper bottles of THC. It doesn't have a great flavor, but if you could just deal with that, and you can chase it with something pretty easy. And you want to make sure if you take it on an empty stomach again, it's going to, it'll spike and it might help with the pain, but it will disappear real quick. If you take it on a full stomach where you've had some fat to eat, it will work more slowly. Then the nice thing about the dropper is that you can play with your dose and see what you need. Lots of times with pain, you need to just break that pain cycle, and then you can kind of stay on top of it. So you're going to have to play with the dose of how much you'll need. The nice thing with a dropper, it's going to be less expensive than getting it in a gummy form, and it's going to be easier for you to play with your dose that way. I get frequent shooting pains in Prometheus, my cancerous neck tumor, probably 4 times daily. Each time I have this pain, I get between 1 to 6 sharp pains. Some have stopped me from moving. Do you know why I'm having these pains? Usually when you get like stabbing, shooting pains from the cancer, so pain has to do with either the tumor affecting a pain receptor, so how you feel pain is you have pain receptors, and you have 2 different types of pain receptors. It could either be the cancer affecting that pain receptor, maybe a motion of your body that moves the cancer to affect that pain receptor, or inflammation that's associated with the cancer that's affecting that pain receptor. So getting those pains like that, that come sharp pains and go, have to do with the pain receptor. The weight of Prometheus is heavy on my neck. Any suggestions to minimize the load? Consider using one of those gator things that people use over their face when they're out fishing and stuff when it's cold morning. That might give you some support, that it's easy to stretch and pull on over that, and it won't constrict so much to cause pain. And then it's easy to throw in the wash machine and clean. You could consider an ace bandage and just cut it shorter so you can use it to pull up. Some sort of scarf, I would think, would help. It is purging lots of fluid, grayish, pink, and some blood strains. The smell is very pungent, so suggestions to make this more tolerable. Well, you want it to be purging. That's what we want to be happening. The pungent smell is dead cells. The smaller lump on the neck is starting to impede my vocals. Again, suggestions. Using your anti-inflammatory nutrition and increasing the anti-inflammatory nutrition is really the answer to that. If you're using any over-the-counter anti-inflammatory medication like Advil or something like that, see if that makes a difference with your vocal cords too, because what an Advil is really an anti-inflammatory. Recently, a breast cancer patient asked about the wisdom of having a lumpectomy in order to reduce circulating tumor cells. That made me wonder if I should be giving a more serious consideration to surgery as well for the same reason. I have been putting it off because I did not want the further burden on my body's system. Now, however, a year in, I'm 80 pounds lighter and much better place health-wise. My surgery, however, would be a double mastectomy. I found one using a guide from Green Smoothie Girl. That's a biological dentist. So this person is answering that question about finding a biological dentist. Green Smoothie Girl. There are some Facebook groups out there too that you might be able to consult with biological dentists. Yeah, so I am not, if you're in a much better place health-wise, is there a time for getting a mastectomy? Yeah, we've had lots of patients do that when they feel like they're kind of stable and better health, getting it removed. They feel better about themselves, feel better about getting the cancer off their body. Everybody's an individual, so I don't want to push anybody to do that. We have patients that have never even considered that, and they're convinced that if they would have done that, they wouldn't be alive today. So everybody's different. So you really have to be praying about it so that you know what's best and right for you. Some of my friends take 200 milligram ibuprofen 3 times a day for short-term joint pain relief. I was thinking maybe I could take curcumin instead or some other herbal type product. Yeah, taking ibuprofen and acetaminophen are hard on your liver. So it is an issue with your liver that you are causing damage that you can't see. So you do need to take that into account. And it's like people, you can't see the damage to your liver. You don't feel the damage to your liver. So, it's hard to, and boy, if I take these, it's really helping. Taking 800 milligrams of ibuprofen 3 times a day, that's a lot. So, yeah, I would definitely, for me personally, I would definitely try curcumin and boswellia and other anti-inflammatories, in high doses. Think about trying the liposomal curcumin. That might be better absorbed. You might have better relief from that. I would try those things for sure. Going on a 3-day motorcycle trip, and this is the person that was dealing with bone-on-bone hip pain. I would try the liposomal curcumin. How toxic are implants? You're talking about breast implants. They can be very toxic. Even if they don't leak, they can still be toxic. A person can have a sensitivity to the silicone. They can have a sensitivity to the outer lining, other chemicals in the outer lining. It doesn't mean that everybody's going to have an issue with a breast implant, but they can be a hidden cause of chronic disease. They could be a hidden cause of autoimmune issues as well. Doesn't mean it's always going to be, but it certainly can be. I have a few spots on my breast where the masses are pushing through. Any ideas on that? You can do topical things on that. Certainly doing different essential oils like frankincense, lemongrass on there would be appropriate. You might want to use a carrier oil with it because those can be hot oils and can irritate the skin. But the closer it gets to the surface, the better you are doing. So you don't want a breast cancer going deeper towards the chest wall. That's what we don't want. So when it's moving towards the surface, that's always a very good thing. So keep doing everything you're doing. I would suggest putting the Rife bulb right over that spot, right over the masses when you're running your programs. That would be helpful as well. Since I've been on a low animal protein diet, my thyroid panel is not as good as before, although I am taking the same Armor thyroid. If this is because of my diet, can I use some kind of amino acids without glutamine? Also, I have found out without certain amino acids, the detox does not happen in the body. Yes, there's amino acids that you need. Those are called essential amino acids. And then there's also a group of amino acids called non-essential amino acids because they're not essential for you to consume in your diet because your body makes them out of other amino acids. So remember, glutamine is the amino acid. It actually converts to glutamate through a certain gene sequence, an enzyme that's made through the GLUT genes, and then glutamate is a neurotransmitter. So that's another issue with glutamine. If a person has got a diet full of glutamine, even if they don't have cancer, and they have defects in that gene, they can convert that glutamine to glutamate quite quickly. Glutamate is an excitatory neurotransmitter and can cause OCD, anxiety, ADD, ADHD issues, and that's a huge problem with young people with ADD and ADHD. So in older people, typically anxiety and OCD. So yes, eating, you could get all your amino acids through plant-based proteins as well. But, I think this person, we started on some animal proteins. And lots of times people, I am not a person who thinks everybody should be a vegetarian. I'm certainly not. And if your cancer is not driven through certain meats, I think you should be eating them. I think they can really give you a lot of not just joy, but I think it can give you a lot of energy. So it's a good source of your B vitamins, and it's sometimes necessary to help build your blood. How do you determine a breast mass is close enough to the surface to use black salve? We have to be very careful using black salve. You really need to find somebody local that you can be monitored with if you're going to use black salve. But if you're going to use black salve on a cancer, it has to be really close to the surface or already broken through the surface. We've had people do black salve on a tumor that has yet to break through the surface, but you have to be mentally prepared, because the whole idea of black salve is that it's going to break through the surface, and that's not a pretty sight. It's going to be a wound. It's going to be an open sore. You're going to have to deal with this maybe for months and months and months, maybe even years, using multiple black salve applications. You have to be mentally prepared to jump into that whole realm. So I suggest with people that are thinking about doing that, as you go on YouTube and you search black salve for breast cancer or black salve for a black salve use, you can go to blacksalveinfo.com. They have some videos on there. That's where most people buy their black salve. We don't sell black salve. But you really do need somebody local that you can have be looking at it, and you've got to be prepared, because it's a lot of work too, because you're cleaning the wound twice a day, and you are having to, dress it twice a day, and it's very difficult. So some women, with breast cancer are like, I just rather get a mastectomy. Some people are like, no, I'm not doing that. I'm going to save my breast. I'm going to do everything. Again, everybody's in a different place, and that's a decision that you're going to have to make, but you got to do your investigation before you go down that pathway. Should I be using black salve since I have an open wound and change my bandage 4 times a day? You could certainly investigate that. That's the problem is black salve was really, really created for skin cancers. So when you have a skin cancer the size of a centimeter round, and it isn't even hardly raised on the skin, that's really what black salve was created for. When we start using black salve on very, very large tumors, that's not really what it makes it very difficult. So do go on blacksalveinfo.com. Do investigate it. I'm totally open to investigation. I'm open to trying new things. I'm open to you doing everything you possibly can. I think that's what we're called to do. Is be asking God, what is there anything else I could do? Should I do this? If I was in your position, I certainly might. I don't know. I would be praying about it and asking God whether that's something I should do. And there are other things, if we feel like we're not going in the right direction, that we can attempt before that. But I'm totally open to whatever God's leading you. We'll try to help people in every way that we possibly can. I just want people to know what they're getting into before they do anything. So All right, any other questions? Just saw a cancer webinar that discussed urology. What are your thoughts? So, not sure really what the question is. Urology is the study of the urinary tract, bladder, ureters, urethra, kidneys. So, don't really have to be a little more specific on that. You mentioned I could perhaps use something else. What would you recommend? Call and schedule an appointment with me. I have to look at what we already have you doing. So, but I do want to get your feedback on which direction you feel like you're going, whether you feel like you're getting better or getting worse. We certainly don't want you to slip down a slippery slope very quickly. So call and schedule a time with me tomorrow if you can, please. And praising God for you in this guidance. Thank you. Well, thank you. I'm praising God for you, and I'm praying for you. God had me up praying for all you guys last night for a long time. So I just need to, please, if you're going to pray for me, pray that I stay close enough to him that I can hear him. Because sometimes I get crazy busy in this world and I don't listen. And I think when we don't listen, I know for me, I'll just say it in my personal experience. When I'm not listening to God, I'm listening to my flesh and I'm listening to the world, and you just don't have that close relationship with him. And it's like you just have to slow down and shut up and listen to him and be obedient to what he's telling you. And that takes discipline, and that is a work on our part. That's a work that we have to be diligent with, to be obedient to. You know, God does require obedience. Our daily verse is perfect for that. Do not be anxious about anything. Doesn't mean we're not going to have anxiety, but it's a reminder that when we have anxiety in every situation, we need to have that relationship with him, that we're going to him in prayer. And prayer here means that communication with him and petition, asking him with an attitude of thanksgiving. We present our request to God, and just our number one request to him has got to be, Lord, just keep me close to you so that I know that I'm walking in obedience to you. And if I'm not, discipline me, teach me, disciple me, shape me, mold me to shape me more into the image of your son. And that is what our purpose here is. All right. I love you guys, all of you. I'll be praying for you. And make sure you guys remember that Ann's Q&A is on Monday too. So jump on that as well. All right. Love you all. Bye-bye for now.